Hello everyone. I was hoping to record a live stream this evening, but unfortunately the gods of technology have been against me today. My sound has not been working on YouTube live all evening. Don't know why. So I'm just going to record this. This is my third attempt, so please excuse me if I sound a bit exasperated. So this episode is called Angry Guts. It's supposed to be live. It is now pre-recorded. I'm just going to be talking about the difference between irritable bowel, inflammatory bowel disease, and endometriosis. These are three very different conditions, but they're all linked by having angry guts, hence the name, hence the title of this episode. Before I get into it, and I'll start talking about what those conditions entail, how they differ from each other, and some strategies and maybe ways of approaching them. I just want to do the usual disclaimer, which is that while I am a medical herbalist, in this video I can't prescribe or diagnose anything. This is the internet, so I'd recommend that if you do have serious medical conditions, that you book an appointment with a qualified medical herbalist like myself, or go and see your doctor. Maybe there are some things that you can take from this video, but I wouldn't suggest just starting taking something for a serious condition without getting professional advice first. So with that out of the way, I just want to differentiate between inflammatory bowel disease and irritable bowel syndrome, because these are things that a lot of people get confused about. So irritable bowel syndrome, IBS, is quite common, and IBS is basically an umbrella diagnosis and a diagnosis of exclusion, meaning umbrella diagnosis, it actually is it's caused by lots of different things coming together, or it can be, and there are multiple different causes. So it's generally thought to be a functional disorder, meaning that there's no single hardcore underlying pathology. There's not some serious infection. There's not some serious pathology going on underneath, but it can cause serious distress and loss of quality of life. And it basically entails abdominal pain, can be constipation, can be diarrhea, a mixture of the two, all sorts of gut upsets, basically. And it can be quite debilitating, and it's often very stress dependent. I'll come back to irritable bowel syndrome in a moment, but to differentiate between inflammatory bowel disease, as the name implies, there's active inflammation going on. Like if you look into the bowel with an endoscope from the top end, or with a colonoscopy from the other end, you will see inflammation going on, and sometimes bleeding. There's erosion of the walls of the gut. There are two predominant types of inflammatory bowel disease. There's Crohn's disease, which can affect the whole length of the bowel, and anywhere from the mouth to the other end, or ulcerative colitis, which, as the name implies, colitis. The inflammation is mainly restricted to the colon. But they can both be very severe. They can lead to severe weight loss. They can entail severe abdominal pain, drastic malabsorption. They can threaten life. They can be very severe conditions. And then the other condition, which is entirely different, endometriosis, is scandalously under-researched, I think, because I see clients with endometriosis quite frequently, and yet it seems to me to be less often reported on, or like if you look on PubMed, the main sort of medical research site on the internet, you will find there is not as much written about endometriosis, and I partly suspect that maybe because it's a gynecological condition. I don't know. I'm not one for banging on about patriarchy, but it does seem a bit weird that there's less written about it, when it seems on the ground, at least in terms of patients and clients, it seems to be pretty common. And it can be very debilitating. Basically, with endometriosis, the endometrium is the lining of the womb. And what happens with that is that every cycle, so this endometriosis is something that affects women before the menopause, basically. every cycle when women have their period, with endometriosis, you get womb lining tissue growing outside the womb in the abdominal cavity, sometimes in other places like the lungs or around the stomach, or just basically the womb lining cells seem to migrate or appear, there are different theories, elsewhere and just start growing. And this can cause, as you might imagine, a lot of pain. And around the period when the womb lining breaks down and is shed, basically this womb lining that's sort of grown like benign tumors elsewhere in the abdominal cavity or in the body starts to break down and causes lots of inflammation and pain and other problems. So endometriosis can be pretty severe and pretty painful. All those three conditions, therefore, those three groups of conditions, very, very different. And just to return to the IBS thing, I said it was an umbrella diagnosis. There's lots of different things going on there. There are many things that can contribute or are thought to contribute. For example, we know that it's often very stress related. So that could be, for example, because people get stressed, and that stress will reduce the amount of digestive secretions. For example, if somebody is in a highly stressed state, that's what's known as a sympathetic dominant state. They've got loads of adrenaline and cortisol kicking around. That can have numerous effects on digestion, one of which would be it would shut down or reduce the amount of digestive secretions. That would change the chemistry of the gut and might therefore alter the microbiome. So you get more bad tenants moving in potentially, which irritate the bowel lining a bit. It could also, if somebody's chronically stressed, have an effect on the immune system in the gut, in that you get a downgrading of certain responses to other gut flora. There's all sorts of reasons why. So the stress itself can affect digestion by directly switching off or on digestive secretions. What's the autonomic nervous system really means the automatic nervous system. It's the part of the nervous system that governs automatic processes like our breathing, our respiratory rate, our heart rate, our digestive secretions, all of that kind of stuff. So when somebody's really stressed, we will enter sort of sympathetic dominant. Sympathetic just means, it doesn't mean what the word sounds like it means. It means adrenaline dominant sort of state where things will start to shut down. It's the fight or flight thing rather than the opposite, which is parasympathetic, which is rest or digest. And in IBS, it's like that autonomic control of the gut, of the digestion, can sometimes be quite wonky. So there are, anyway, with IBS, it's thought there could be a microbiome thing to it. It's thought there could be a problem with the autonomic nervous system control. You might have heard of that. There's a branch of psychotherapy now called polyvagal theory, the vagus nerve being a principal nerve of the autonomic nervous system, which innervates the digestive tract and the lungs and the heart, and really sort of stimulates that parasympathetic rest and digest functions. And we know that emotional dysregulation can have negative effects on the sort of regulation of autonomic nervous system functions like digestion. So but there's this indirect effect of when you get stressed, this can indirectly, via the digestive secretions and via the immune system, affect the flora, the gut flora, and that can irritate the bowel as well. But there's lots of other theories about IBS. I put in the description box below this video on YouTube, I've put some links to generic overview papers on IBS and IBD. And I'm sorry I'm rattling through this. As I say, this is the third time I've attempted this today. So please bear with me. All right, so just some ideas. I mean, all of these conditions, very, very different. But some generic approaches. I think what unites them is this angry guts thing, this thing of abdominal pain, basically, and often sporadic, non-continuous, to varying degrees. So somebody with Crohn's or ulcerative colitis might get sudden attacks of inflammation. Somebody with IBS might get regular or sporadic abdominal pain without that overt inflammation, and somebody with endometriosis will tend to get that cyclical monthly inflammation. But in all cases, I suspect that there is likely to be some benefit to be had from some looking at this in a bit of a sort of trauma. trauma being physically expressed kind of a way. Now, I have no evidence for that, except I'm thinking a little bit medievally in terms of medieval medicine, because follow me round this bend. This is a bit of a left field one, but in medieval medicine, they categorize things astrologically. Now, whether or not you believe or use astrology, I'm obviously a big proponent of it. I love it, but it's got very little scientific proof. But if you don't believe in it, the interesting thing is that they categorized certain things. They lumped things together. And that was empirical. It was based on observation. And I'm not one of those people who thinks our ancestors were idiots. I tend to think that if they did something, there was probably a reason for it. Now, they may well have been wrong, but they weren't stupid. So what they lumped things together in this instance, the moon was the symbol that they gave to, they said traditionally the moon ruled the stomach, the bowel, the brain, and the bladder. So all the bags inside us, basically, all the bags and the brain, the meat of the brain. So we talk a lot in modern physiology about the importance of the gut-brain axis, and we know that there are signals being sent from the microbiome to the brain and from the brain back to the gut. It's kind of like a circuit of signaling. So it's interesting to me that in medieval medicine, in ancient Greek medicine, going way back, that the moon was the symbol of the bowel and the brain, and also symbolized security, home, mother, infancy, and what else? I think those are some of the, and food, but those are some of the main things. So what I find fascinating about that correlation of those things in that one symbol is that it does suggest that there may be a link, or that a link was observed between the sort of security and one's experience in infancy and mothers or being mothered, that sort of primal early experience of safety or mothering, and perhaps the link between the gut and the brain, which is to say, if you have angry guts, there may be some sort of trauma-related link between early domestic disturbance or disturbance of one's sense of safety or security with parents or at home. I don't know. This is all speculation. But what I do think is that if this is a pattern that resonates, then sometimes the way to deal with these things is by a sort of quiet confrontation. And by that, I don't mean attacking people or being passive aggressive. I mean actually just looking at the things that make you feel insecure, the things that threaten your emotional well-being, and perhaps taking action. And you don't need to blow a trumpet. There doesn't need to be a fanfare. Just taking action to deal with those things. That may entail some fairly ruthless stuff, like cutting people out who are bad for you. But it could also be getting rid of certain, I'm just checking my notes here, it could also be getting rid of certain goals or behaviors that aren't serving you anymore. Some things that were sort of programmed in from childhood that are habitual, that are no longer good for you, and that actually cause you stress. And I like the attitude. I heard this on a podcast a while back, and I thought, oh, that's great. Somebody saying when they go into a debate, they go in with a samurai attitude, meaning, and the samurai had this thing of they'd already died, they were already dead. When they go into battle, you're already dead. So what that means, I think, is sometimes when you have to make changes to your life to deal with things that are re-triggering past stress, or that you need to make some drastic changes, it's sort of take that samurai attitude. You're in the sense that, not in the sense that you're literally already dead, but in the sense that you are already experiencing stressful problems. So there may be, it's worth your while just to sort of say, well, I'm already in this stressful place. So maybe there are things that I could do now that could improve matters. So just be quiet and determined and do those things, I think would be a useful mindset to take, the sort of samurai mindset. I'm not referring to the samurai the samurai practice of disemboweling oneself if one fails or is dishonored. I think that would be counterproductive, but more the attitude of, if you're already in that situation, then taking action would be a good thing. The other thing I'd mention would be sometimes just on the practical side, and this is well documented, forms of temporary food restriction like fasting temporarily can help to reduce inflammation. I think probably in all of these three very different conditions, because fasting will temporarily, obviously, generically help to reduce inflammation a bit a lot of the time. And in IBS specifically, perhaps FODMAP, fructo-oligodiemonosaccharides. Have a look at the FODMAP diet. Some people find that helpful. I think it's usually, for my clients, I usually advise a more generic strategy of identifying if there are any foods. We go through the diet and see if we can spot any foods that are triggering inflammatory reactions, and try to eliminate those, and also just reduce the eating window a little bit. That just seems to help sometimes, just to sort of mean that people are doing the window fasting thing, the intermittent fasting thing. It's a bit of a sort of trendy practice at the moment, but it does seem to help a lot of the time. So just in terms of, I'll mention 3 plants and then I'm going to sign off and try and upload this. So the 3 plants I was thinking for IBS, there's lots of different herbs, medicinal plants that could be useful in these conditions. So these are not specific recommendations, but if any of these plants seem to fit the bill for you, then they might be worth investigating further. The first would be one that's often more commonly thought of as a sleep aid or for anxiety, and that's valerian. But actually valerian is quite good for colic and bowel upset and tension in the bowel. So this would be more for your IBS type, and particularly I find it useful in IBS where there's some constipation and bloating. What I call rabbit dropping poos, little pellet poos, little tense, that's some high sphincter tone, that's high sympathetic nervous system tone is how I tend to think of it. They're all tense and kind of like can't do a proper poo, a bit constipated. So with that, particularly with that bloated rabbit dropping poo kind of situation, and the person's feeling a bit anxious, particularly if their sleep's a bit disturbed, valerian can often work quite well as a herb. It doesn't suit everyone. Some people find it a little bit stimulating, but actually it's good gentle relaxant. And it's often used combined with other herbs. I've heard a lot of people now saying they get tolerant to valerian. If they respond to it really well initially, over time that response diminishes. But when it's combined with other herbs, it can often work it doesn't lose its efficacy when it's combined with other things. But if you're relying on valerian on its own, it might not work as well as it always did initially if you have a good response to it. So it's better combined with other things like, say, chamomile for irritable bowel. But that's a herb that can be very, very useful, particularly if there's a combination of anxiety, physical tension, bloating, and maybe some sleep disturbance as well. Valerian is great. For inflammatory bowel disease, obviously this requires a proper medical oversight. You want to, if you're being treated this, you really do need to see a herbalist professionally, and because if you've got it, you'll know it's no joke. If you have an acute episode, they can be really, really dangerous. But I will mention one plant that I think is very interesting, and that is wild yam, or Dioscorea villosa, and it was recommended as a menopause remedy, but it really isn't. I'm going to read from the Eclectic Materia Medica here, which is 19th century herbal medicine, but they were really good at getting into the details of what plants did. And they say about wild yam, this agent is an antispasmodic, and solely for the reason that it cures bilious colic. It also says in all forms of colic and other painful abdominal neuroses and all forms of gastrointestinal irritation. If it does not relieve in 1 hour, the medicine should be discontinued. It has allayed the pain incident to the passage of biliary calculi, that's gallstones, when given with full doses of gelsemium. That's quite a toxic plant, so I wouldn't recommend doing that if you're not qualified. It has also proved valuable in painful cholera. Again, we wouldn't use it for that nowadays. In neuralgic affections, in irritable conditions of the nervous system, especially when attended with pain or spasms, in spasmodic hiccup, obstinate and painful vomiting, gastralgia, and in one case of spasmodic asthma. So what I find fascinating about wild yam is it sort of got this reputation as a hormone remedy for menopause when actually it doesn't work for that at all. I'll read you an excerpt from a more modern, a more contemporary herb book in a minute on that. But what it does work very well for, or what it is quite good as, is an antispasmodic and anti-inflammatory for the gut. So I've found it quite useful in certain cases of IBS, irritable bowel, and also in inflammatory bowel disease. I prescribe quite high doses of this, sometimes with a strong astringent. That's a binding medicine. If somebody's getting an acute attack of inflammation with diarrhea, high doses of wild yam with that seem to really help. What did really help. It really helped the patient. It sort of got the pain down, reduced the diarrhea pretty quickly. So I found it to be quite useful. I have put some links in the description box on YouTube below this video. And you'll see from those links that there isn't a lot of research on wild yam. I've put a paper with lots of research on different species of yam, of all the different Dioscorea species, but wild yam itself, there's not a lot at this time, which is a shame because it's an interesting plant with lots of interesting steroidal compounds in it. Steroidal compounds often being anti-inflammatory. They can be hormone modulating, but don't appear to be in this case. One word of caution with wild yam, with Dioscorea villosa, it does seem in some animal experiments to maybe be a bit harsh for the kidneys and for the liver. So if somebody has liver disease or specifically kidney disease, I wouldn't give it. Also, I wouldn't give it in high doses for a long period of time. I've given it previously for 1 to 2 months with being absolutely fine, but I'd be very cautious if somebody had a liver or kidney disease. So just about wild yam and its hormonal or lack activity or lack thereof. This is the British Herbal Compendium it's about 10 years old now, maybe a bit older, but this is a sort of set of monographs of medicinal herbs. And they talk about the in vitro, that means in the laboratory experiments with wild yam showing no hormone activity, no estrogenic or progesterone activity, saliva from women taking diosgenin, that's one of the main steroidal compounds from Dioscorea, wild yam, containing preparations was found not to possess any progesterone bioactivity. However, there was some administration of diosgenin, that again is one single compound from wild yam, was injected into mice, and in those mice it did stimulate the growth of breast tissue, suggesting estrogenic activity. But in clinical studies of humans using wild yam cream, there was absolutely no hormonal activity whatsoever. So basically, in the laboratory, the whole wild yam had no hormonal activity. In live human women, wild yam applied topically as a cream had no hormonal activity. But in live mice, injecting one constituent from the yam under the skin did appear to have some hormonal activity. So the jury is still somewhat out, but I think if we had to go on the weight of evidence, it would be that it doesn't seem to have any hormonal activity. However, given that these trials did pick up, particularly in the laboratory work and in the mice, it did have anti-inflammatory action. And it also, in the laboratory, it inhibited the whole wild yam extract. And one of the compounds from the yam, dioskin, inhibited the proliferation of some breast cancer cells, which was cervical cancer cells, beg pardon, not breast cancer. And there was also saying here, traditional use of wild yam in treatment of rheumatoid arthritis. There was some anti-inflammatory activity in mice and a reduction in progression of bone loss, as in osteoporosis, in some rats whose ovaries had been removed. So there was a traditional use of wild yam for inflammatory conditions, and it seems in the laboratory that it reduced these sort of hyperplastic, these conditions with cell multiplication, which is interesting. But I would generally recommend it for its traditional recommendations of gut inflammation. The final herb I'm going to mention, well, I'll do a bonus one as well. The final herb was wormwood, which I think is fantastic. That's a couple of small trials have shown some benefit in Crohn's disease. It's an incredibly bitter plant. It stimulates digestive secretions. It helps reduce abdominal pain and increase absorption. It's not good if you've got heartburn because it's very, very bitter and will stimulate stomach acid secretion. It's also slightly antidepressant. And I think it's a useful herb for people who have been through trauma because it actually seems to stimulate the will and pick up. It puts a bit of, I don't know, it sort of picks you up a bit. It's a very, I mean, the taste of it will make you shudder. It's incredibly intensely bitter. So yeah, I'll speak more on wormwood in future episodes. And the final herb I want to mention is calamus root, which is this guy here. This is one from my own garden. I grow this, or it grows in my garden, I should say, in my pond. And these are the rhizomes, actually, that I harvest. And this is a fantastic digestive herb. There is some prevalent misinformation about it containing acerone, which is a carcinogen in high doses. But in fact, this variety, which is the American variety, doesn't contain any acerone at all, which is why it's the one that I grow. The European variety of calamus does contain a little bit, but it's in medicinal doses, it's nothing to be concerned about, particularly if you're using it for short periods. This variety of calamus, the North American variety, was highly prized by Americans in their history. I'm talking about indigenous Americans, not the colonists later on. The indigenous Americans, this is an incredibly important medicinal herb for them. I use it in almost all their mixes. And the reason I'm mentioning it as a bonus herb is because not only is this quite useful for some people with IBS and even IBD, because it really helps bloating and abdominal pain, it's also been found to be useful, not in any experiments. This is anecdotal by a great herbalist called Henriette Kress. She highly recommends it for endometriosis. And the traditional way of using it would be to snap off a little chunk and just suck it. And it's apparently very, very helpful for the pain of endometriosis. So not something I have yet had chance to recommend to a client with endometriosis, because I've only been harvesting it regularly for the past sort of 4 years or so. I've given it to a few clients with different conditions, always with positive feedback. So anyway, an interesting one. And again, I've put a link to a whole blog article by the herbalist Jim McDonald about calamus in the description box below this video on YouTube. So I'm going to end it there. This was longer than I meant it to be, and a lot later and not live. But for anyone who's watched it, thank you very much. Please do, if you found anything useful in this video, please do like it and share it. And hopefully I'll be able to see you live next week if I can sort my sound issues out. All right, thanks for watching. Bye.